Did you know that there are many different ways that we can treat vein disease? Let's explore all of the available options because there are many and you do have an option. At the end of the day, what we want is to close the abnormal veins. Many years ago, over 20 years ago, we used to do surgery in the hospital under anesthesia to take all of the abnormal veins. That was literally a very barbaric procedure that required general anesthesia, lots of downtime, pain, bruising, and thankfully we've replaced that with procedures that we do right here in the office, procedures for which you can literally drive to and from. We do them under local anesthesia, so there's no sedation. You can literally leave the office and continue on with your life. And actually, we do want you to be active and go back to work or go to the mall, go golfing, just literally stay active following the treatments. All of the treatment options are, the goal is to close those veins. We're not taking them out. We're going to close them. We're going to stop that abnormal flow that's happening in the retrograde fashion. We want to stop that, and we want to reroute the blood to the rest of the veins that are healthy and working properly in your legs. Now we have options as far as how to get those veins to close. Traditionally, the main treatment that has been used for at least 20 years, if not more, is actually using heat. We can use radiofrequency or laser energy to close those veins internally. We're literally going to cauterize that vein. And all of those procedures are actually done through very little needle pokes in your legs. There's no incisions, there's no stitches, there's no scars. And those types of procedures can easily take anywhere from 15 to 20 minutes. We go inside of the vein. We use this special device that is going to generate the heat internally in the vein, and we treat any segment that we want. We cauterize it and we come out, the vein is immediately closed. Now, after that treatment was developed, we've developed multiple other modalities, again, that are just different ways to close the vein. So we have other options such as medication. It's called varithena. Varithena is a medication that when it comes in contact with that inner lining of the vein, is actually going to get those veins to close down. It hurts the vein in an irreversible way, and it leads to closure, and eventually the body gets rid of that vein over time. That procedure is also done through a very small needle poke without the need for anesthesia or use of energy like we were discussing with radiofrequency or laser. Other treatments involve using a kind of glue, it's called cyanoacrylate, to close that vein internally. And there are other modalities that combine mechanically hurting that vein internally while using some sort of variation of a medication that hurts that inner lining. But regardless of what method we use, you will have closure of those veins. Blood will be rerouted to the healthier veins, and that over time will help you go back to feeling better. We're going to alleviate that congestion that happens. Your blood flow is going to be restored, and therefore we can see improvement in the symptoms of pain, heaviness, swelling. And we will also going to be able to address those varicose veins, those bulging veins, by closing them also with medication. Again, a medication that is created to close abnormal veins. In very few instances, we may choose to actually take some of those bulging veins out, but we tend to do that less and less nowadays that the medications that we have are so much better in closing those veins. So overall, very comfortable, very easy to do treatments that we do right here in the office that you can drive to and from yourself and have essentially no downtime.